Hi guys, so this video is all around a disc prolapse or disc herniation or disc bulge. What that actually is that when a disc starts to become worn out, it'll tend to bulge. Okay, and that bulge then, if it's severe enough, will tend to put some pressure on the nerves as it exits the spine. Now we have 33 different types of disc, ranging from the ones in the top of our neck all the way down to the base of our spine. And those discs are of different shapes, different sizes and different thicknesses depending on where in the spine we actually have them. And so, for example, the discs in our lower back and our neck are actually quite thick and provide for a lot of shock absorption, but the discs in our mid-back are actually quite pancake-like, and so it's exceptionally rare that we have a disc prolapse in our mid part of our back, and more common in our neck and more common in our low back. So there's a couple of things to say about disc prolapse. And the first thing is that they're actually a lot more common than you might think. And we know that because a recent study was conducted where we took 100 people, or rather MRI'd 100 different people. 50 of those people had a history of back and neck pain, and 50 of those people had no history of pain whatsoever. And the question was asked, can we tell just based on the MRI whether we can predict which one of those people would have had pain and no pain? So the question was asked, and we asked three lots of consultant radiographers to actually go into a dark room and actually look at these MRI scans and actually try to determine, based on the MRI scan alone and not knowing anything about patients, which people were more likely to have pain and which one weren't. And the answer was really, really interesting. And what we found is that actually they couldn't tell, based on the MRI, whether that person was likely to be in pain or wasn't likely to be in pain. And the reason for that is by the time we hit 40 or more, it's exceptionally likely that we're going to have one or more prolapsed discs in our spine. It's a very common occurrence, and that shouldn't worry us. It just tells us that as we get older, having disc prolapse is relatively normal. And most people who have a disc prolapse, they won't actually experience any pain. Often when they do experience pain, the reason for the pain is usually down to one or two things. One, there's a degree of inflammation that accompanies disc prolapse caused by irritation, or two, actually the disc prolapse is quite severe. Now, what we're looking for is when we look at the disc itself, it's very much, as I say, like a water balloon, and when you squeeze a water balloon, it creates a bulge, and that bulge then can kind of exit the spinal column and start to put pressure on the nerve, and if it bulges enough, it can start to irritate the nerve, then giving us our sciatic symptoms down the leg or our pain down the arm. So that's the first thing, is the magnitude, the amount of bulge often is going to be the key thing as to how much pain we're experiencing. And there's a second thing that's really, really interesting. It's a bad analogy, but it'll serve the purpose. If you think of your disc as a jammy dodger, so in the middle it's got like a jelly-like substance, and that jelly-like substance is called your nucleus propulsus. And your nucleus propulsus then is surrounded by the biscuit, which is called your annulus fibrosus, which is very fibrous and very firm. And the reason for that is because the annulus fibrosus is supposed to keep the nucleus propulsus in the jam inside the biscuit. Because what's very, very interesting about the jam is that it doesn't contain a marker of yourself. And so what that means is that every single tissue structure in your body actually has a stamp, in some sense, that tells your immune system that that's you, and so that so that your immune system does not seek to attack it. If it does attack it, then you have a tremendous inflammatory and immune reaction, which is often very, very dangerous. With the discs, though, what's really interesting is this jelly-like substance does not have that major histocompatibility complex. It doesn't have that marker of self. And so what that means is if the disc gets warm and the jelly-like substance creeps through the disc and goes outside the disc space, forgive me, then you're going to have a tremendous immune reaction. It's going to be fantastically painful. And often that's the reason why people are in so much agony. But what's been very, very interesting about the horrendous events that we've all experienced over the last 2 years with coronavirus is there's some very interesting data that's flowed off the back of that. And one of the interesting things is, very sadly, all of those people that were due for elective surgery for sciatica type symptoms for disc prolapses were denied surgery because most of the elective surgeries were shut down, obviously, due to the NHS's response to the coronavirus. And so those people generally had to then wait for surgery. And they had to wait a long time, usually a year or more. And what we found as the operating theatres started to open up again and the hospitals were available now to take on more elective surgeries, they actually found that their symptoms had improved. And one of the more interesting things about disc type problems is, in some sense, the worse the disc injury actually is, the more painful it is, the better the treatment outcome is likely to be. And the reason for that is that the disc itself has a certain amount of hydration. And if the disc then leaks a lot of its hydration, you get this most fantastic, unbelievably painful immune response, because the marker of self, the jelly-like substance, has leaked out of the disc. And then you get this fantastic immune system reaction where it gobbles up all of that liquid. And once it's gobbled up, the amount of bulge retracts back off the nerve, and actually the disc feels a lot better. And in the majority of cases, actually, if you're able and it's a very difficult task, if you're just able to get through the worst period, the most painful, perhaps 4 to 6 weeks, 6 to 8 weeks, if you can get through that period, you actually find that the disc will start to heal. And it will heal in the sense that it'll start to pull back off that nerve and sciatica starts to improve. And what we found looking at the statistical data from people who've had surgery is that in the short term, if you do have surgery, because you actually clean up all of that discal material that's causing the inflammation, you will feel an awful lot better in the short term. But if you actually look at the long-term data, providing over perhaps 18 months, you find that actually in the longer term, there's very, very little difference between those people who have surgery and those people that had not had surgery and just had conservative therapy through actually exercise. And so the most important thing that we need to think about is when we rehabilitating from a disc is to understand that there's a time scale to this, and whilst you're having that acute inflammatory reaction, it is going to take time, and the key then is just to find movements that you're actually able to do, and you can find that in our disc rehabilitation section. And you want to try to reduce the inflammation. And then once as the pain starts to improve, it's then really important to try to stabilize that area through exercise and start to rehabilitate it through strength.